My name is Laura Degraw, and I'm a third-year nursing student. It is totally normal to feel overwhelmed and nervous your first few days of clinical because of your new role as a student. The often overwhelming expectations can also make you feel stressed. In this presentation, I'm going to talk about a few of those stressors and give you some ideas on how to manage them. As a nursing student, you will have many different experiences in the clinical setting. Clinical placement can be a very intimidating experience for junior nursing students, especially if you have never had any experiences in caring for others. For most, clinical placements are introduced within the first few months of the program and often cause much stress, anxiety, and fear. One of the main stressors for nursing students in clinical is the initial experience. Everyone is nervous their first day of clinical, and that is totally normal. I remember on my first day, I started crying within the first 30 minutes on the unit. I was so overwhelmed with having to interact with clients, let alone having to do primary care independently in my first few hours. Others may have difficulty sleeping prior to the clinical experience because of nervousness. If you feel like you're experiencing this, you are not alone. Studies show that sleeplessness can be linked to poor workload, performance, and knowledge expectations, which can make your initial experience overwhelming. Many students going into clinical have a difficult time applying what they've learned in lab and demonstrating it in the clinical setting. Studies show that nursing students start as novice nurses and will eventually gather enough knowledge in their learning to become expert nurses. But it won't happen overnight. Some students think that their prior knowledge combined with their gained knowledge will help them, but do not expect to be an expert on the first few days. It's okay to ask questions. Building good relationships with your colleagues will help make the experience better. Prior to attending clinical, it's imperative that you have a sense of comfort with the skills that you've learned in lab. As nursing students, you cannot assume that you are an expert because of your knowledge gained in theory and lab. It takes time. There are lots of different aspects in nursing that you're going to take experience to learn well. If you make a mistake, don't sweat it. Your instructor can be with you if you feel like you are not confident enough to do it independently. If your instructor corrects you, don't take it to heart. They are responsible for your growth as a novice practitioner, and they have your best interests at heart. If you feel uncertain, ask a friend to come with you to ease the anxiety a bit. If you feel like you can't accomplish a skill, it can lower your self-esteem, and we don't want that. Remember, you're smarter than you think. There are many resources available for you right on campus. If you were at another school, please check for similar resources there too. In year 1, a student mentor group is available to support you. We have been through a similar experience and can share survival strategies with you. We have been in your shoes and can help you with studying, papers, or just simple questions about life as a nursing student. Professors are a great resource when it comes to sharing of information, clarification, and support. They're there to support your growth personally and professionally in the clinical setting. They are a great resource in your development of critical thinking, independence, and allowing you to apply theory with practice. They will help guide you in the direction of success. Please do not hesitate to seek their help. The Learning Center, across from the library, can help you out in many ways. They offer tutoring for most of your classes. They also do workshops during the school year on stress management, time management, and test taking. The Learning Center's mission is to provide individualized learning opportunities and ongoing support to diverse populations of students, both in accessing the college and in meeting their individual learning goals. Last but certainly not least, the Crombie Center is located on the 2nd floor, just outside the gym. They support students with disabilities and help them to reach their educational and career goals. They offer many services such as free counseling and supports for universally accessible learning. Your clinical instructor should be your primary resource in the clinical setting. They're there to support you, guide you, and allow you to grow in a supportive environment. Maintaining an open communication with your clinical instructor is critical. Studies show that students have difficulty approaching their educators. Remember, it is always best to communicate with your clinical instructor to ensure a good working relationship. Your clinical instructor is there with you to make sure you are able to apply all the concepts and skills you learn in lab and theory. If you do not understand a skill or do not feel comfortable applying the skill to a resident, they are there to support you. You will get to know many residents. Many of them love having students to chat with. Always remember that the long-term care facility is their home. Therapeutic communication techniques must be put into place as soon as you enter the room. Remember, always knock before you enter their room. You wouldn't want someone you don't know coming into your home before knocking, right? Always introduce yourself. Hi, my name is Laura Degraw and I'm a first-year nursing student. This will allow the resident to trust you. Always remember to promote independence with your resident. Allow them to pick up their own clothes, make their bed, and wash themselves if they are able to. Most institutions have been established for many years, and remember, you are probably not their first nursing student. Always remember that you are a guest in their building. Be respectful and make sure you are polite to the residents and staff that work there. If you act polite and respectful, they will treat you the same way. Your relationship with your peers is important too. They are one of your main support systems during clinical. If you ever feel nervous or want someone to help you with a skill like a bed bath or feeding, you can grab one of your peers and they will ease your anxiety and help you through the situation. Just remember, your feelings about anxiety and stress in the clinical setting are normal. You are not alone in the way you feel. It is okay to feel nervous because it is a new environment. Seek support from mentors, professors, services on campus, and peers. You can succeed. Thank you for watching this video. Let us know how it has helped you and what else you'd like to see. For more information and education, you're welcome to subscribe to NurseKillam on YouTube and/or ustudynursing.com. You can also like our Facebook page to interact with nurses worldwide.